Recently on Reddit, I had someone reach out to me and ask me about their teeth. He shared a photo of their smile, and they had some spaces and some gaps between his upper front teeth. And he had been to a dentist, gotten some estimates, and wasn't sure which way to proceed, if he should get composite veneers or porcelain veneers. So since I couldn't make him a recommendation as to what he should do in his particular situation without seeing his teeth and checking a bunch of different things, taking a whole bunch of photographs and x-rays, I just gave him some pros and cons of both types of treatment modalities so he can be better informed. So basically, while composite veneers and porcelain veneers make you think that they're going to be very, very similar, they are similar, but they're not. They're completely different types of treatment, and they're used in different situations. These are some pros and cons of the two types of treatments. I'm going to start with composites first. So composite is the white filling material that dentists use to fill teeth nowadays. We can actually use that material on your front teeth and bond it to the tooth to close up little gaps, sometimes to cover up the front of the tooth, etc. as a veneer. I found it's nice to use the material because it's usually a very simple one-visit appointment where the material gets bonded onto the tooth and corrected whatever issue it is that it can correct. Because it's only one visit, there's no lab fees involved, the cost of it is much less expensive than porcelain veneers. And also, because it can be done freehand in the office, if you do chip it or break it, it's usually a very simple repair. Again, just a one visit, come in, rough it up again, and rebond it. The cons of it is that because it's done freehand in the office, if the tooth needs a lot of shape changing or if it's numerous teeth, it's very difficult to get them all to look right in the office on the patient. Some dentists, it kind of depends on the dentist. I know a lot of dentists, or there's some out there that are amazing with composite, and they're artists. They can do pretty much anything with direct composite on somebody's tooth in the patient's mouth. But most dentists find that honestly a really good dental lab making nice porcelain veneers can do a much better job, especially if every single tooth in the smile is going to be redone and worked on. And since the composite isn't as strong as porcelain as well, it is more prone to chipping and breaking. Again, that's kind of mitigated by the fact that it is easily repairable in the office. And also, because the composite material is somewhat translucent, it's not the best choice to mask a really dark tooth. If you're somebody that had a root canal tooth root canaled on one of your front teeth, you notice that tooth is probably darker than the teeth on either side, even if you bleach it. So you think, oh, I'll get a veneer to cover that color up and blend it in with the other two teeth. Composite, for me, not the best choice. I'd prefer to use a porcelain veneer in that situation. All right, so now let's move on to porcelain. One of the pros, as I mentioned, because the veneers themselves are made in the dental lab on a model, the technician has a lot more time to get the contours just right and perfect, and the colors can make them very lifelike and look very, very natural. And because they are made out of porcelain, generally they tend to be stronger than the composite. They still can chip, you can still crack them, you can still pop them off the tooth, but they do tend to be stronger. Usually any type of case where I'm placing a lot of porcelain veneers on a patient, or even some composite veneers, I will tell them I highly recommend a night guard to help protect the teeth, so that way you're less likely to damage them if you grind while you're asleep. So the cons of porcelain is that if they do break, you can't really repair it. If it chips, a little bit of porcelain chips off, it cracks. If it pops off, it stays in one piece, you may be able to re-cement it, rebond it onto the tooth. But if it breaks, you need to, if only part of it breaks off, you got to remove the rest, drill off the rest of the veneer and make a new one, and then bond that into place. And because there is a lab visit, the lab actually has to make it. It does take multiple visits to have the veneers made and placed. And due to that, it's going to be a lot more expensive to have a porcelain veneer compared to a composite veneer. In my office, it's easily 3 times more expensive per tooth for porcelain veneers versus composite veneers. In my office, what I do when I see a patient, first thing I ask them is, what don't they like about their teeth exactly? So I know what things we're looking to correct. And if it's a small thing, like say they have a gap between their front teeth, kind of like I do, like David Letterman and Madonna do, that's something a lot of times I can easily correct with bonding. Just add a little bit of material to both teeth on either side of the space to close it up. And again, usually done in one visit, freehand, and simple to do, simple to maintain. If something chips or breaks or falls off, repairs are very easy. If the person though has numerous teeth, or pretty much every tooth in their smile, they're unhappy with the appearance, or if they have really dark teeth, as I mentioned, some root canal teeth can end up being very dark. Years ago, kids were given tetracycline. It's an old type of antibiotic, and that caused severe staining in teeth as they were developing. So then when their adult teeth came in, they had these really dark gray, almost black coloring to them from the tetracycline staining. So in those situations, again, the porcelain will cover them up more. And it's another situation is also if somebody's got very crooked teeth, but they don't want to see the orthodontist. This was kind of big back in the late 90s, early 2000s. It was called instant ortho. Basically, person with crooked teeth, you can veneer the fronts of the teeth, and all of a sudden their teeth were straight, or at least they looked straight. The roots, the teeth underneath were still crowded together and crooked, but they looked much better afterwards. So in those situations, again, porcelain is going to be the material of choice when you're doing big cases, every tooth in the smile. So on top, that's usually 10 teeth on top and 8 to 10 on the bottom. Another situation where I'm more likely to use composite versus porcelain is if a patient comes in, they know their teeth are failing. I've had a few people like this. They know their teeth are failing. They know they're going to be in dentures at some point in the future, and they just want their teeth to look nicer for right now, for a special occasion, child's wedding. They just want to look nicer for themselves. They know they can only get a few years. In those cases, I will do composite veneers, where basically just fix up every single tooth with composite and try to help the patient maintain them for as long as possible. And then usually within 5 years, most of the time, those teeth end up failing, and we have to transition them to either a denture or to dental implants. All right, so to sum it up, in my office, like I said, I'm more likely to use composite veneers if we're just doing something small, 1 tooth, 2 teeth. Any more than that, I find it much easier just to do porcelain veneers, have the lab make them, and usually we try to also do, at least if we're going to do porcelain, we'll do 1 or 2 teeth, that we could do it that way. 4 teeth, once you get more than 4 teeth, you generally don't want to do just the front 6. There's a photo of the actor Matthew Perry from Friends, who early on he went to see a dentist and just got his front 6 teeth veneered, and you can see in the photo how his front 6 teeth are super bright white, but then you look a little bit further back onto his premolars and they're very, very dark. And that photo is used now pretty much in any aesthetic lecture I've ever been to. That's the go-to photo to show what not to do when doing porcelain veneers. So thank you guys so much for watching. Thank you for the question. Anybody else have any questions or comments? Please leave them down below.